Thank you, Your Excellency. Can you see me? And can you hear me?
Yes, we can hear you and we can see you clearly. Thank you.
Thank you so much. Honorable Minister Rose Toki Brown and the outgoing Chair, Honorable Minister Mohammed Isham Jafar, Regional Director Dr. Saya Piukala, Honorable Ministers and Heads of Delegation, Excellencies, dear colleagues and friends. Good morning, and I apologize that I cannot be with you in person. I just came back from Rwanda. As you know, there is a Marburg outbreak in Rwanda, and that's why I couldn't join you in person. And I congratulate the regional director on his first report, which paints a comprehensive picture of the region's work over the past year. There are so many encouraging signs of progress in the report and in the various progress reports that you will review this week. You have many achievements of which to be proud, especially in disease control. The Mekong Malaria Elimination Program is a standout success, driving a more than 90% reduction in cases and a 70% reduction in deaths over 6 years in Cambodia, the Lao People's Democratic Republic, and Vietnam. I also congratulate Vietnam for being verified for the elimination of trachoma, which you will celebrate together today. Many member states have made progress towards eliminating other neglected tropical diseases, including leprosy, lymphatic filariasis, rabies, schistosomiasis, and yaus, along with school deworming programs and water sanitation and hygiene initiatives. In your fight against NCDs, I congratulate Cambodia for banning marketing of alcohol near schools and at sports events, Cook Islands for passing new tobacco control legislation, Fiji for raising taxes on tobacco, alcohol, and sugary drinks, Lao PDR for implementing plain packaging, Malaysia for banning the sale of e-cigarettes to children, and the Philippines for the Healthy Hearts Program, which has achieved high rates of hypertension control. On emergencies, I commend the regional office for its effective response to the increasing number of dengue outbreaks in the region and to this year's drought in Mongolia. We should all be grateful that the region has been spared the number and scale of emergencies that other regions have faced in the past year. But you have been far from idle. I commend member states supported by the regional and country offices for the hard work you have done on emergency prevention and preparedness by strengthening lab capacity, establishing national emergency medical teams, and through IHR self-assessments and joint external evaluations. As you know, at this year's World Health Assembly, member states made significant steps towards strengthening health emergency preparedness, prevention, and response. The adoption of a set of amendments to the international health regulations and the agreement to conclude negotiations of the WHO pandemic agreement before next year's assembly or sooner are major achievements. Although member states have made progress on the pandemic agreement, some of the most crucial issues remain unresolved. I urge all member states to continue listening to each other within the region and beyond, to continue to seek common ground, and to conclude a strong agreement by the end of this year, if possible. And I know it's possible to conclude the agreement this year. It's in your shared interest to do so. Excellencies, Despite your many achievements, you face many challenges, which are also reflected in your agenda. Like many regions, the Western Pacific has seen significant improvements in health service coverage, but worsening financial protection. So I welcome the draft regional framework for health financing with its 5 action domains on public funding, more equitable and efficient spending, primary health care, governance, and economic and social policy. Another key challenge for the region is realizing the potential of digital health, which is largely untapped in many parts of the region. So I likewise welcome the draft regional action framework on digital health and its 5 action domains on governance, infrastructure, finance, digital solutions, and data. The 3 panel discussions on primary health care, oral health, and climate resilience are also good opportunities for member states to share experiences on key issues. Meeting all these challenges requires a strong, clear plan. So I commend Dr. Saya for his new vision for the region, weaving health for families, communities, and societies. This new vision sets clear priorities for both member states and the region and country offices supported by headquarters. I look forward to seeing the 5-year targets that you set together. These priorities are well aligned with the 14th General Program of Work, which member states adopted at this year's World Health Assembly. GPW 14 incorporates lessons from the past, the realities of the present, and our aspirations for the future. It's based on a clear mission to promote, provide, and protect health and well-being for all people in all countries, and to save 40 million lives over the next 4 years. To support the implementation of GPW 14, we have launched the first WHO investment round, which aims to mobilize the sustainable and predictable resources we need to do our work. We look forward to your participation at today's investment round event. Of course, we well understand that member states expect a strong return on investment from the resources they entrust to WHO, and so they should. We are committed to continuing the journey of transformation we began more than 7 years ago to make WHO more effective, efficient, transparent, accountable, and results-oriented. One of our key priorities now is to strengthen our country offices to provide more predictable, more stable, and more tailored support to member states. I'm pleased that WHO country representatives have been empowered through greater delegation of authority, along with enhanced capacity and positions in country offices to meet member state needs. Excellencies, dear colleagues and friends, I leave you with 3 requests. First, I urge all member states to engage actively in negotiations for the pandemic agreement and to complete it by the end of this year. And second, I urge all member states to implement the 14th General Program of Work and the new vision for the region set out by my brother, Dr. Saya. And third, I urge all member states and partners to participate in the WHO investment round. Thank you all once again for your commitment to promoting, providing, and protecting health for all people of the Western Pacific. And Honorable Minister Rose Toki Brown, back to you. And thank you for this opportunity, and thank you for allowing me to join you virtually. Although, as I said, sorry that I couldn't be in person with you. Thank you so much, and back to you.
Thank you.